Let's begin with Acapulco, or Cassia alata, also known as ringworm bush or candlebush. It is indicated for topical application in treating fungal infections caused by common dermatophytes. The formulation uses Acapulco leaves, which are the most cost-effective part of the plant. Adverse effects are generally mild, including pruritus and a transient burning sensation. A scanning electron microscopy study showed that exposure to C. alata causes shrunken and collapsed forms of hyphae and macroconidia in fungi, such as M. gypsum, T. rubrum, and P. marnefi. This is due to leaks in the cell wall and altered membrane permeability, leading to the loss of cytoplasm. Randomized controlled trials on Tinea versicolor showed that Acapulco 50% lotion is not inferior to the positive control, sodium thiosulfate, after 4 weeks of treatment. Adverse effects were compared between the 50% Acapulco lotion and 25% sodium thiosulfate. Both treatments reported similar numbers of patients experiencing pruritus. However, the Acapulco lotion had 1 case of a burning sensation, while the sodium thiosulfate group reported 0. Cassia alata disrupts fungal cell wall integrity, leading to mycologic cure rates equivalent to sodium thiosulfate. The mechanism involves cell wall leaks and loss of cytoplasm. The formulation protocol is simple. Pound and express the juice from fresh leaves, then apply it twice daily for 3 weeks. Next is Yerba Buena, or Mentha cordifolia, which is indicated as an analgesic for acute moderate to severe post-operative pain. Each tablet contains 500 milligrams of Yerba Buena leaves. The recommended dosage for adults is 2 to 3 tablets every 6 hours. The most common adverse reaction reported is nausea. Phase 3 trials compared Yerba Buena leaves against paracetamol for pain relief in various post-operative cases. The pain relief was assessed via a verbal response scale after 6 hours. The data compares the percentage of patients reporting very good, and fair pain relief for both treatments. Moving to Tsaang Gubat, or Carmona retusa, also known as scorpion bush. Its indication is for gastrointestinal and biliary colic, and as an antispasmodic. The formulation is 250 milligrams per tablet, with adults taking 1 to 2 tablets 3 to 4 times a day. The main adverse reaction is nausea. A mixture of triterpenes from Tsaang Gubat, including alpha-amirin, showed anti-diarrheal activity. Studies on patients with biliary colic compared the pain intensity relief of Tsaang Gubat versus dicyclovirine over time. Both Carmona retusa and Mentha cordifolia use volatile triterpenes for rapid antispasmodic and analgesic relief. Tsaang Gubat provided 96% no pain relief in biliary colic, comparable to dicyclovirine. Yerba Buena achieved 95% to 100% very good pain relief, comparable to the positive control in post-op pain relief. Ampalaya, or Mamortica charantia, is indicated for type 2 diabetes mellitus. The McKeeling variety has the highest blood sugar lowering activity. The formulation is 500 milligrams per tablet, with a dosage of 100 milligrams per kilogram per day in 2 divided doses, 1 hour before meals. Adverse reactions can include nausea, headache, and gastric pain. A phase 3 trial compared the mean fasting plasma glucose, or FPG, between Ampalaya and glibenclamide over a 12-week period. The Ampalaya dosage was 100 milligrams per kilogram per 24 hours, taken twice daily, 1 hour before meals. Mamortica charantia significantly reduces fasting plasma glucose in type 2 diabetes mellitus over a 12-week period. Ampalaya achieved a minus 40.8% reduction, while glibenclamide showed a minus 36.8% reduction in mean FPG. This next section focuses on formulations intended for the community. We will discuss medicinal plants used for various community complaints, specifically dermatologic issues like fungal and bacterial infections, GI complaints such as intestinal worms and diarrhea, and respiratory complaints. This section covers dermatologic conditions, including cutaneous bacterial and fungal infections and scabies. Formulated extracts offer viable community-level interventions for bacterial infections and scabies. This includes Bayabas for bacterial and fungal interventions, and Cacahuate and Macabuhay for parasitic interventions like scabies. We begin with a focus on cutaneous bacterial infections, specifically discussing Bayabas and Gumamela. Bayabas, or Psidium guajava, also known as Guava, is indicated for bacterial skin infections, abscesses, impetigo, and infected wounds. In vitro and in vivo studies show Bayabas has good antibacterial activity against S. aureus and group A strep. It contains flavonoids like quercetin and guaiaverin, which demonstrate antibacterial activity. For community formulation, pound fresh Bayabas material and apply it as a poultice over the affected area. Alternatively, boil the leaves and use the lukewarm liquid to wash the area or as a bath. Studies have shown that guava extract has efficacy against various microbes, including S. aureus and Group-A strep, as well as some fungi. Next is Gumamela, or Hibiscus rosa-sinensis, which shows in vitro antibacterial activity, particularly against Staph aureus. For community formulation, pound the fresh flower buds and apply as a poultice over the boil. Moving to cutaneous fungal infections, we will look at Acapulco, bawang, and tanglad. Bawang, or Allium sativum L, commonly known as garlic, is known for its efficacy. The Ilocano variety is noted as being more efficacious than the Taiwan variety. Bawang contains organosulfur compounds, which include allicin and ajoine, derived from cysteine. Studies on ajoine treatment on A. niger showed severe damage to hyphae. Garlic oil also showed a low minimum inhibitory concentration on C. albicans, causing organelle destruction and cell death. To formulate bawang, crush 3 to 5 cloves and rub the fresh material on the affected area twice a day for 2 to 3 weeks. The image illustrates the community formulation of bawang, emphasizing the process of crushing and applying the fresh cloves to the affected fungal areas. This image highlights another view of bawang for community formulation, showing the raw garlic material. Let us continue with lemongrass, or Cymbopogon citratus staph, commonly called tanglad. This plant is often used for its various properties. The phytochemical component in lemongrass is citral, a major component of lemongrass oil, which is a combination of geraniol and nerol. Lemongrass essential oil and vapor are effective against certain fungi, including Mucor sp, Aspergillus terreus, and Candida tropicalis. This slide focuses on community formulation of medicinal plants. Next, we discuss the community formulation for scabies. The recommended community formulation for scabies uses cacahuate and macabuhay. To prepare, pound fresh leaves to express the juice. Apply the juice to the affected skin twice a week for 3 consecutive days, repeated for 2 weeks after bathing. Moving on to gastrointestinal, or GI, complaints. We will cover intestinal worms, diarrhea, and intestinal colic. This image emphasizes the focus on GI conditions and is used as a transition slide. For intestinal worms, the discussed plants are ipil-ipil and niyog-niyogan. Ipil-ipil, or Lucina leucocephala, uses its seeds to combat intestinal worms. Ex vivo assays showed that ipil-ipil seed extract reduces the movement of Ascaris sum, suggesting a paralyzing effect. It is also effective against enterobius, comparable to pyrantel pamoate. This slide provides additional visual reference for ipil-ipil and its use. Niyog-niyogan, or Combretum indicum, is another option for addressing intestinal worms. This image is a visual transition for the topic of intestinal worms. Next, let's discuss diarrhea, focusing on guava, or Psidium guajava. Guava extracts inhibit intestinal motility and may also have anti-secretory functions. It shows activity against rotavirus and contains lectin, which binds to E. coli to prevent adhesion to the intestinal wall. Finally, for intestinal colic, the recommendation is Tsaang Gubat, or Carmona retusa.